Hey guys, Dr. Brooke Chirilli here. I'm a physical therapist with Age Fit Physical Therapy and Wellness, and today we're going to talk about the balance system, do a quick review, and then we're going to talk about the inner ear specifically. So there's three components to the balance system. The first is our sense of touch, so tactile sensation through our fingers, through our feet, feeling uneven ground, bumps, grooves, anything that our skin can bring in and tell our brain so that our brain can react to that. The second is our sense of vision. So when we look all around us, taking in the environment, our surroundings, and then reacting to what we see so that we don't trip over something, trip over the dog, trip over a kid, whatever it may be. And then the third one is our inner ear and our vestibular system. And so our inner ear, as you can see from this model, there would be an outer ear. You come in through the tympanic membrane or the eardrum, and then in the back here is our cochlea where we interpret sound, and then these are our semicircular canals. And the job of the semicircular canals and these organs back here is to sense our direction, like our head, where it is in space. And so if you may have heard of a disorder called BPPV, and that's benign paroxysmal peripheral vertigo. So what that is when the crystals get loose in your ear. If you've ever heard someone say they got rocks in their ear, they got crystals floating, that's what BPPV is. So those crystals are actually little components of calcium carbonate, and their job is actually, they are supposed to be there. They're supposed to be lining the walls of the semicircular canals, and their job is as the fluid in the ear floats around, it kind of tells your head where it is in space based off the movement of the fluid against these tiny little hair-like things called cilia, and the crystals then interpret that movement, send that to the brain. So every now and then, those crystals get loose and then they float in that endolymph and that fluid in the canals. Sometimes it's because of an ear infection. It could be a medication we're taking. We went swimming. Sometimes there is a known cause, and sometimes we just really don't know. But what we do know is that if you get it once, you're more likely to get it again, and the prevalence increases as we age. But what happens is these little crystals end up floating through the canals, and that gives us a false sense of where we are in space. So instead of knowing exactly that our head is turning or rotating wherever it's supposed to be doing, you get these extra little inputs from the crystals floating around, which are in constant movement, and then the brain gets confused and it doesn't know how to react. And that's when you get that sensation of vertigo or spinning that you hear people talking about. So how do we fix BPPV? Well, it's actually pretty simple. It doesn't sound simple, but it's pretty simple. So we can actually do a test where we lay your head back and we actually watch the direction of your eyes. And based off where your eyes are moving and bouncing tells us what canal it's in. Based on the canal it's in will tell us how we need to rotate your head and your body so that we can essentially dump the crystals out of the canal into these little organs, and effectively they just kind of dissolve and go away. So it's really cool and it's really fun to watch, maybe not so fun to experience, but that is the vestibular system in a nutshell, and that's what we want to talk about today. So I hope you guys learned something, and if you get dizzy, come see us. We'll dump those crystals right out.